More than 45% of the 10,000 people on the kidney transplant waiting list are Hispanic, and more than 25% are black.
Many die waiting for those organs, and during the pandemic, it's gotten even worse. Health reporter Haley Hernandez is joining us now with more on this. Haley?
Hey guys, I was shocked to learn that nationwide transplant centers were only doing 50 operations a month. That is down from 600 before the pandemic started. This is not an elective procedure, so that is horrible and extremely discouraging for people who are clinging to the transplant list, waiting for a donor in order to live. But one teacher from Atascocita is doing what he can to control his destiny.
Sean Wilburn is 45, a thin, lovable teacher, and this is his difficult daily life, coming home and setting himself up to a machine in order to get a full night of at-home dialysis.
9 hours of my life on a daily basis is hooked up to a machine, and that's a lot for anybody.
It's a lot of hurting and waiting for 2,800 black Texans on the kidney transplant list. Sean's worried if he doesn't find a living donor, he won't survive the disease.
So I put it on Facebook, Instagram, and Twitter.
It's a good plan if he can find someone. But during the coronavirus pandemic, transplant operations plummeted when doctors weren't sure whether it was worth bringing patients in for an operation and hospital stay.
The selection criteria for the recipients changed in a way that you only took people who are less sick, younger, because those are the people who are less likely to contract the virus.
The good news is Dr. Ibrahim says Houston Methodist Hospital is back up to speed to pre-pandemic numbers. But for several months, patients like Sean had no hope. And now he's hoping he hasn't missed the chance for life-saving opportunities.
I don't think COVID should really be something you should worry about in dealing with donating. You have people like myself who mean a lot to people. You know, I've been an educator. This will be my 25th year. And I think it would probably devastate some people if I were not here.
And the doctor says now that they have the capability of testing both the donor and the recipient before and after surgery for coronavirus, they are more confident in bringing donors back in. As for Sean, though, guys, I talked to him. He is still waiting for that perfect match to come forward.
Oh, Haley, thank you. So what is it going to require on the donor's end?
Yeah, well, really great question, because first of all, the recipient's insurance company does cover the cost of the donor's operation. Also, the National Kidney Registry pays for lost wages and transportation for up to a month. In Sean's case, he even says that he's willing to pay for any lost compensation past those 4 weeks. But, you know, if you're curious about becoming a match for someone, I've put a website or an article up on our website, click2houston.com, with everything you need to know about becoming a living donor.